this is the days of the week that you're open, Monday from Sunday through to Saturday, and the delay these are the days of the week that somebody has a TIA, and how long it takes to get to the unit. And when you're open 5 days a week, it looks like that. And when you're open 4 days a week, it looks like that. I'll go back and forth. And what it shows is that when you're open 5 days a week, Tuesday is the best day to have a TIA, followed by Wednesday, followed by Thursday, all of which are pretty good. If you go to 4 days a week, there's only one day that you want to have a TIA, and that's on a Tuesday. The rest of the week, your delay is so long that you're probably not getting treated in a timely fashion. So just another message about the response. These are all kind of making the same point that if you're going to see TIA, you're going to have to see it quickly. Otherwise, it may not be, not have impact. Also, if you're going to start setting up TIA units, there's something else which is important to keep a handle on, and that's the people who don't make it to your unit, because you don't know about the people who don't show unless you follow them up. So out of a year's patients where there were 900 people, 600 of them were actually TIAs, and we could guess that if we had no unit, that 60 of them, 10%, would have stroked out, and that if we had a unit, 10 would have stroked out. So we would have saved 50 people from stroke. But during that same year, 140 people didn't show up at our unit. They were our no-shows. When we followed them up, they had a high stroke rate, or stroke or admission rate, 10% of them, once again. So, and if we hadn't followed them up, we wouldn't have known about the 14 extra people who ended up in hospital because they just didn't show up. So I'm just going to finish off with, we have been funded by the Heart Stroke Foundation to look at Vancouver Island, sorry, let's turn that off, to look at Vancouver Island as an epidemiological laboratory, and where we can try and measure everything that goes on, much as they did in Oxford, and see if we can measure all of the TIAs, and try and get them all seen in one of two clinics that we have on the island now, one of two units. And we're going to do it by getting the general practitioners involved so that they get sent through to the units. But we're also going to invoke a new system, which we're now experimenting with, where as soon as the referral comes in, because they come in by fax, that a nurse gets on the phone, phones the patient, and we start the encounter right then and there, and so get a better idea of what's going on. And then we can triage them into our rapid assessment unit, but also triage them to other places if they sound really like they're something that's not appropriate. Because as we started to advertise our unit, we started to get more and more patients, and that was harder to manage them. So we had to have some way of dealing with them so that we didn't lose our efficiency. So the last slide is to go back to this provincial strategy. We're busy trying to measure what's going on in the province now with various mechanisms, looking at physicians' billings and looking at discharge diagnoses and such. But for the time being, this is just a prediction of what might be out there. And so the first lines are the ones I showed you before, where the number of TIAs and mild strokes in the province could be 6,000 patients. If you add mimics to that, then the number in the province would be 10,000, almost 11,000 patients. And so that's the volume that we would need to manage. So Fraser would need to be managing about 3,000 patients overall if they're going to see them, and coastal 3,400, and the interior and the north probably around 2,000. So that's a lot of patients. But with the help of by virtue of the BC Stroke Strategy, the help of the Heart and Stroke Foundation at making this all happen, and the Ministry of Health at pouring some new money in to make it happen, we've assessed where the need is, and new rapid assessment units have been set up. New rapid assessment units have been set up around the province. Fraser Health have now got 3, and since February are on their way to 1,430 patients a year, about the same as Vancouver Island are doing, but they got there in the first year. And Interior Health have also just opened a similar rapid assessment unit, and have got others taking form. Vancouver Coastal already had units in place and are expanding the volume, and we don't yet know what the numbers are there for me to be able to put those on the graph. So we're well on our way to about 5,000 patients around the province who are going to be managed in units. So looking like we could be halfway to the ultimate volume of what we would like, and that in just a few years since this strategy has taken form. So it's been a really satisfying process to be involved with the help and push that we've had from people like Diane and Mark Collison, who've been masterminding all of these strategic plans. So I'll open the floors or boardroom tables to questions.